Oh!
And that's the home run, baby.
Oh! Wow. You make me see light.
Ah, gotcha! Home run, baby.
Oh!
I gotcha.
Ay, ay, ay.
Ay, caramba.
Ay, caramba.
Ay, caramba. Hi, Reina.
Hi.
Nice to meet
Nice
you.
to meet
Welcome
you.
to the office.
Thank you.
What brings you here? How can I help you?
The most important for me is my TMJ here
Okay.
on the right. I tried to work it out. I've been to a doctor and they...
What happened to your TMJ? When you say TMJ, for some people who don't know the TMJ, TMJ is the jaw.
Mhm.
Yeah?
Well, I have a click when I open my mouth. He said, well, you have TMJ. And so I went to a pain doctor because I don't really have pain. I just feel the click when I open my mouth.
And what is the click is really what we have to talk about.
Right there when I open my mouth.
No, I'm saying is when people are saying I have a click, what does that mean? And I'll explain what that is, okay? Now the thing is, it can be your TMJ. It can be an upper cervical. Nerve pressure up here has connections. It could be an occiput. Okay?
Okay.
It could even be a shoulder causing a click. Surprisingly, okay? We'll figure it out. We'll figure out what we find.
Okay.
Okay, so that's number one.
Okay, number...
The TMJ.
TMJ.
After the osteo did some manipulation on it, it felt better for that day. 3 days later, the click is back. And then you just dealt with it, whatever?
Yeah, I just ignore it.
How many years total, you said?
I've been living with this for probably 6 years.
6 years, okay. Is it affecting your chewing or your eating or any of that?
No, but when I see videos on myself, I see like my mouth is going to one side.
Okay.
That's weird, but I don't know if that's normal.
Okay, we'll take a look at it.
Okay.
Okay, what's number two?
In 2007, I was doing Taekwondo, and I was doing sparring, and I fell on my back. And then from that, I was having severe pain for a while.
Low back?
Lower back on the left side.
Shooting pain into the hips or thighs?
It was, no, it didn't go to my thighs, just there, but it was, I couldn't tolerate it to be 3 minutes cooking, 2 minutes cooking on the stove. I had to sit down. In November, I was reaching for something on the chair, and then I feel really like something got jammed. And I don't know if it was my muscles, but because I was dealing with kidney stones on the left side, I thought that I had infection. I don't know if that's related to that. So I gave it to the infection, to the kidney. So I didn't do my back. But I couldn't walk straight at all. Like, I was walking like...
So you had energy work done, you had no pain, and then how long after there was no pain this happened?
This happened like 3 months ago.
3 months ago.
And then 1 month later, again, I got fixed for somehow. And 2 months later,
Fixed by treatment or fixed just by...
It's just by itself.
Okay.
Yeah, and then again, I reached for something, and again, I got jammed. And I was like there for two days.
Okay.
I was just ignoring because I thought it's going to get better. So
maybe it'll go away, people.
maybe it'll go away.
And it didn't. It came back.
Well, no, I'm fine now.
Okay. So you don't have any low back issues?
No, right now, no. Once in a while it comes up. Maybe I sleep on the wrong side. I don't know.
You've adapted very well. I want to do a little example real quick, okay? So, I just want to hold your wrist. Let's say I have a rubber band, and I place a rubber band here. Come over here a little bit. So let's say I have a rubber band, I place a rubber band, and I hold it there, and it compresses. And you feel it, right? But then after maybe an hour, a few hours, or even a day if you had it on, what happens? You don't feel it. The body adapts to it. And I think that's kind of what's happened with your low back. I will go over everything and explain it. It's kind of important because you may not have the pain right now. You don't have the symptom, right? Right. Now, but if you do something and all of a sudden it's there, how can we explain that? So nothing was actually fixed. It was the pain, whatever was causing the manifestation of the pain, you dealt with that part of it. But the structural component is still there.
Exactly.
I want to show you that, okay? What else?
Yeah, so I have a
The
click
hip
on
click.
click. When I do only rotations on the outside, I don't have it when I do here, but when I go outside.
So what if you just, we'll test it, when you do this,
no.
you have to go up and out.
Yes.
So what is that?
It just, I feel like the bone is out of,
Okay.
like out of the socket, I feel like it is. like
The left only?
The left only.
Not the right?
No.
Okay. Okay, what else? You get one more. No, I'm joking. What else?
Okay, my ankle, I just sprained my ankle in 1999, I believe, and I didn't do anything either, I just let it go.
Okay.
Are you a functional medicine doctor, right?
I do functional medicine
Okay.
as well for 18 years, yes.
Okay, so my issues, the biggest issue right now is my stomach.
Okay.
I think I have gluten intolerance, and I had a colonoscopy in December the 1st, an endoscopy, and I haven't heard from the doctor yet. I don't know if I have something.
Okay.
I had a CT scan before that with my family doctor. He said that I have a hernia here, and I had
A hiatal hernia?
yes,
Yes.
and
Okay.
kidney stone on the left.
Okay. Well, why are you here?
Because
what are you expecting from me? I'm just curious.
I want you to find and see if there is disalignment in my body.
Okay.
That might be causing me other things that I am not even aware of,
Okay.
including probably the stomach.
Okay.
Yeah.
All right. You've watched videos. You've been referred to me. Someone referred you to
No,
the
I watch
channel?
videos. Yeah,
Okay.
I just find you like probably 4 months ago.
Oh wow.
Mhm.
Okay. Very
Yeah.
recent.
Yeah. Just fixing my stomach. I was looking to functional medical doctors, and then you came on YouTube.
Very nice.
Yeah.
Okay. Well, we got some work to do, don't
Yeah, yeah, I know.
we? So let's figure out. And a reason I ask you, why are you here? Everyone has different things. You know, some people historically now have been coming in and says, you need to fix everything and take away all my pain. That's not my job. My job is to help you figure out what's out of balance and help you get back in balance.
Right.
It starts with what? The spine.
Mm-hmm.
It starts with the foundation of the spine, which is the pelvis and the sacrum. So number one is if we have a proper functioning nervous system, then we know brain is communicating with every single cell in the body, back and forth. Yes?
Yes.
And from there, the second component is going to be nutrition, the gut. So as it was taught to me, spine first, gut second. Okay?
Really?
Now, if we look, and I want to talk about the nervous system for just a second, okay? Okay, so I appreciate you coming. You drove a little bit, a couple of hours, I'm assuming, yeah? We're going to figure out a few things today, and before we get started, I want to talk about the enteric nervous system. So you're talking to me about some digestive issues, right? We have structural issues. And then we say, is there a correlation between the spine and the digestion? And then there are people out there who say, hey, you know, these chiropractors are saying, hey, I can crack your back and get your digestion going. That's not what we're doing, okay? But I want to explain the relationship of the spine, the nervous system with the digestion. Now, we're historically taught in school that there are two nervous systems, right? There's the central nervous system, right, or the autonomic nervous system, and then there's the peripheral nervous system. And I have a couple of charts there that people have seen in my videos. The peripheral nervous system are those nerves that come out of the spine and go to the body. And they power the hands, the muscles, the joints, the tissues, all that, right? Then we have the autonomic nervous system. The autonomic nervous system is the system that controls all the internal organs. And the autonomic, as the name implies, is automatic. It happens irrespective of you doing anything. If I tell you to make a bicep, make a bicep. Take your hand, make a bicep. That's a voluntary thing. You've contracted the muscle, right? If you don't actively tell the bicep, like you're lifting something, it doesn't do it. But what tells the heart how to stay in rhythm? What tells the lungs how to expand and contract? What tells the stomach to produce the right acids and enzymes of digestion? What tells the pancreas to either release bicarbonate or insulin? What does all that? The nervous system.
Nervous system.
So the nervous system either directly or indirectly controls every single function in the body. And the job of the chiropractor is what? To maintain the neurological integrity between the brain and the rest of the body. And we do that by maintaining a healthy nervous system or a healthy spine. There's a saying that posture is a window to your spine. Your spine is a window to your health.
Hmm.
Now I'm going to go back to the autonomic nervous system. There are two parts of the autonomic nervous system. There's the sympathetics. You've heard of fight or flight. You see a snake there, your body reacts. You're either going to fight or flight.
Right.
What if you think the snake is there? It's the same thing. So you're going to fight or flight. And that's part of the stress response. Okay. Sympathetic. Parasympathetic, rest and digest, calms everything down. So those are the main nervous systems that we're taught, but there's a third. The third nervous system is called the enteric nervous system.
I didn't know that.
And it's not talked about very much, okay? And I want to go over to this chart real quick and show you the enteric nervous system, and this is important. The enteric nervous system, and so they've done this, they found that if you take all the cell bodies of neurons in the gut, let me show you over here. Check this out. So this is the autonomic nervous system chart. The dark green, which is a little faded now, looks kind of turquoise right now, but that's the parasympathetic nerve. It comes from the upper cervical, it comes from the sacrum, and it controls what? All to rest and digest. So there's connections in all the glands in the face. There's connections from the vagus nerve, which comes from the upper cervical, that controls parasympathetically all the organs to the transverse colon, and then the sacral plexus takes over from there, from the transverse down. Okay, you see all these nerves here? So imagine this is the gut, the colon, and there's all these nerves that go around the gut. Okay?
There's a lot in there.
So they've done this. Let me just flip this up. So they've done this, and they found that if you take all the cell bodies of a neuron in the gut, it is the same number of cell bodies in the brain of all the neurons. You've heard of that gut feeling?
Gut feeling.
There's truth to it. So that gut feeling. Now imagine people that are getting all this work done here, and especially those voluntary things. And they're removing nerves and tissue and all that stuff. You're losing some of that gut or that instinct.
Yeah.
Okay? I'm explaining that for a reason, because when there's digestion problems, we lose that power, that gut feeling. Okay? And then we start to second guess ourselves. You get what I'm saying?
My main issue since I was little,
Okay.
stomach issues all the time.
Okay, so we'll deal with that. Does that make sense, the
Yes,
enteric?
yes,
Okay.
yes.
Is there anything else? So we have TMJ, we have back, right?
Yes.
And we have digestion, we have a click in the left hip. But my job is to see what's out of balance and figure out where we're going to start.
That's what I'm here.
You ready?
Tune up.
You ready?
Yes, I'm ready.
Well, first we got to align you.
Okay, alignment.
You're getting a major overhaul today.
Yeah, I know.
Are you ready?
Yeah, I'm ready.
All right, let's do it. Now, let's do this. I'm just going to mark the dimples. And we want to watch her walk. You've seen the videos, yes? You know how I want you to walk, but before we do that, let's look at the overall symmetry. And let's see. Right shoulder, right scapula is a little bit higher, a little more pronounced over here. Look straight ahead, please, ma'am. Now, when you're looking here, she's kind of flat in through the spine, and then it goes forward. So I don't really see the curve that I want. I see this. I see a little curve here, and then right about here it bends back. It's not curving back. It's too straight. And then where here it should start to go kyphotic or turn out, it's still going in. So mechanically or structurally, we don't have the right curve in our spine. Next thing, I'm going to check the glutes. Just march in place, please. March in place. Turn this way a little bit. March in place. March in place. Stop. Okay. Now, if we look at the glutes, you can see right side is higher, left side is lower. Right side is a little bit flatter, left side comes out a little more. Okay? Now let's watch you. Walk, ma'am. Go ahead, and I want you to walk towards that nervous system poster. And you're going to walk back and forth several times, please. And you say you coming from La Quinta.
Quinta.
Uh-huh. She got that Quinta wiggle. So that left, she got that left quinta wiggle. Keep walking, ma'am. Turn around, watch the dimples. So the left one does go up and down, but it shifts as well. Stop for a second. I want you to focus here for just a minute, and I want you to watch. They should go up and down. Go ahead and walk, please. So the right one doesn't go up and down. The right one goes side to side. The left one goes up and down, but there's that shift, that wiggle, or the waddle. Okay? Your scorpion's stuck. Keep walking, please, ma'am. So as she's walking, then you can watch her feet and you can see pronation, especially on the, well, now it's going from pronation to supination. And she's getting that bunion deformity on both sides of the big toes. Keep walking. And you can see that, yeah, you don't have pain in your back, but it's not moving right. Okay? Let's go over your x-rays. I think it's going to make a lot of sense once I explain the x-rays, ma'am. And as I go through this, ma'am, if you have a question, please stop me. If you don't understand something, please ask.
I will.
And this is number one, is now we need to figure this out. All right, let's see. This is a picture in time. We have 24 bones in the spine, 23 discs in between, and then we have the foundation of the building, which is the sacrum and the pelvis. This is your side profile. And remember how I was telling you, you don't really have a curve. It curves here and then it bends back. There's no curve in your spine, and I want to explain what this all is. Okay, let's start with this x-ray here. The foundation of your building is what? The sacrum and the pelvis. And this work is based on the level foundation principle. So we need to have a level base and foundation in order to have a stable building. Now, we can see, do we have a level base and foundation? Let's zoom in. And let's look a little closer. You can see the right side is shorter. Yes? The right side is shorter. The obturator is smaller here. This hole is bigger. This is the pubic bone. This is the crease in the bum here.
You can see my IUD in there.
Yes. And you said it. Okay, so you have the pubic bone off from the crease and the sacrum, which tells us what? The pelvis goes down and turns. We'll go through the numbers in a second, but I want to give you the answer, really. You have a bent tailbone, man.
Oh yeah, I had a fall.
You had a bad fall. Look.
Yeah.
Mira. So this is the sacrum here, follow the arrow. Look, it bends like this. And the bend here is part of the short leg. We're going to go to the numbers now and see what they mean, okay? All right, now this should make a little more sense. So let's look at the numbers. We have PI4EX3 on the left. We don't have rotation of the sacrum. We have a short leg on the right. All right, now I get to talk about the things you ain't telling me. Okay? You had a lot of different falls. Okay, and let's talk about it.
I had a skeleton in my closet.
That's something. Now, let me put this together for you so it makes sense. PI4EX3 with a measured difference of 8 millimeters on the right, 11, actual difference is 11. Okay, so this is what's happening. I'm referencing the pelvis. The way the pelvis works like this, right? It works in opposite. One goes up, the other goes down, one goes in, the other goes out. PI4EX3 means this. The left pelvis goes down and out. So it goes out, down and out. And the sacrum on the right, we have a 5 millimeter malformation of the sacrum and an 8 millimeter short leg. So it's doing this, down, out, and then the sacrum bends down this way. Here's the challenge. If I fix your left pelvis and I bring it up and in, it's going to make this hip worse. And you said the click is where? On your left side. Let's put it together, ma'am. So you do have a pelvic misalignment, but if I fix your pelvis right now, or if you've had your pelvis adjusted, it's not fixing anything. The reason why is this is down and out. You got to push it up. If you push this up, this goes down. Because they work in opposite, and there's a 5-to-2 ratio. And the 5-to-2 ratio is for every 5 millimeters of pelvic misalignment, it changes the femur head 2 millimeters. And for correction of that 5 millimeters, it changes 2. So your measured difference is 8 millimeters. There's an 8 millimeter short leg on the right, so the left is up high. Under 7, adjustments will hold. So you're actually above that 7. Now, the actual difference is if we correct the pelvis, what's the actual is 11. So we have a short leg and a short sacrum. Follow my process, man. And that all came from a bent sacrum. This is where we're probably going to need to start to get any sort of help. Okay, does that make sense?
Yes, yes.
That's what was missing. Okay, so you've dealt with or managed the pain component, the symptom.
Yeah.
But structurally is there, and I'm letting you know, it may be a little spicy.
I was using a donut for a year, driving.
Okay,
Donut pillow.
now it makes sense. All right, do you understand what I explained in the pelvis, ma'am?
Yes.
Your foundation is off.
Yes.
From there, let's look at what happens next. Once the foundation is, so you can see this is the sacral baseline here. L5 is also out. You can see this curve here.
Yeah, I see.
This curve is coming because of the short leg on the right. And the short leg is coming from the sacrum.
Sacrum.
Okay. Now, so what happens? It goes off and then it comes back to level here. See? And then the next one to go off is going to be T11. And T11 is going to take 10, 9, 8, 7 with it. And then guess what? 7 is back to level. Número 6. Number 6. So number 6, this is the area that starts digestion. Okay? And then what happens up top here? Same thing. So you can see the body is compensating through from the foundation. And by the time you get up top to the shoulders, you see how it's off?
Yeah, my shoulders are tense all the time.
Right. The right shoulder I was showing you was a little bit higher on the exam. The right shoulder is because of the spine. Okay. The next thing is when we look at the shoulders here, you can see that the head of the humerus doesn't sit properly in the socket, so the shoulders are off, yes. And it kind of superimposes on the top of the shoulder on that side. On this side, same thing. So we're looking at the shoulder. This is the socket here. It's riding a little bit higher. And what that is it means it's anterior. So when the patient is on the x-ray, getting an x-ray taken, the more anterior the structure, the x-ray beams are divergent, it hits the anterior structure first, it presents superior or higher on the x-ray. So we have bilateral anterior shoulders, no problem. I'm just making sure you understand everything I'm going through, okay? Now the fun part. So now you can see, now it starts to kink over to the left side. Yes?
Yeah.
And then we can see that the jaw is off. So we can see the TMJ. This is the right TMJ. This is the left TMJ.
Yeah.
The left is thicker, isn't it?
Yes.
It looks thicker.
Thicker, yeah.
So the left is actually not your problem. The left is compensating. The right is the issue. Okay? But your click is where?
The right.
Yeah. Left, nothing has happened in the left yet?
No.
Good. Okay. So I confirm the right TMJ with whatever's going on with you. Now, does that make sense?
Yes.
Now let's go to the side profile and see what happened here. And I have a lot of good news here too. Give me 1 second. All right. So first thing I want to do is a posture assessment, L5. L5 goes straight up and it should bisect between C2 and C7. It's showing us what? And I'm not worried about the numbers, I'm just showing you that it is different. 2, 3, 4, 5, 6, 7. So what it's showing us is that you carry your upper body behind your foundation. This line should go between 7 and 2 for proper posture. This upper part of your body is behind your foundation. So just like in a building, if the foundation or the upper part is behind, there's more stress put on it. Your muscles are working hard. That's why you have that tightness and stiffness in the
Right.
upper body. It's because of the posture. Does that make sense, ma'am?
Yes.
Okay, let's continue. Now let's get some answers. On the side. Now as we zoom in, there's that nub, there's your falls. You had at least 2-3 good falls, lady. You played rough. You ain't telling me what you were doing. You grew up in La Quinta?
No.
Okay.
No. My country. Oh yeah, I fell
Where
when
are
I
you
was
from
little.
originally?
Honduras.
Oh, nice. Okay, very cool. I don't know if I've had anyone from Honduras here yet.
I'm the first one.
I think
Yay.
so. Very cool.
Where's everybody?
But you've had a couple of major falls, ma'am. Okay, does that make sense? And then we
Yes.
have a bent coccyx.
Oh.
Okay, now let's continue. From there, we can see, as I was showing you what, there's no curve here. And the fact that we're seeing all of these circles, these are all compensations from the undersurfaces. Even L5 has that. So I don't see that that's where I want to start with you, ma'am. I see it somewhere down in there. Does that make sense?
Yes.
Okay, now let's continue up. The discs are good. That's your good news. These discs are all good. You had an old compression injury there. Discs are fantastic, fantastic. Now, level discs. They should be level, like that. Level. Sorry. Level, level. It opens there. 1, 2, 3, 4, 5. We're on T5, T6. Okay? T5, T6 is that digestion area. That's liver, gallbladder, stomach. By the way, this area is the kidney.
No stones.
I don't know. I don't know if I see stone there. Let's see. No, but we got some few other things to talk about now. Okay. You need to get your thyroid checked. You had your blood work done?
Yeah, I've been doing it.
Okay. I need you to get your thyroid checked.
Okay.
Okay, thyroid panel with TSH.
Okay.
I'm seeing a finding that's potentially there. There's some calcification of the costochondral junctions, which is just little excess calcium.
Yeah, I have pain in the rib. That's what I've been going
On
today.
the right side or the
On
left
the
side?
left side.
Okay. Now, here's what's a little confusing in your digestion. There is digestion issue. And you can see here, if you look close, this is the permeated moth appearance. This is undigested, ascending colon, transverse descending. I can see a lot. I mean, we can change the contrast. This is all undigested food. Comes over here, undigested food. Here's what doesn't look, I would expect a small Blvd with you, but yours is a decent size. Which tells me, you see this piece here? I mean, it's still half the size, but it's still a good size for someone who has digestion issues. You may have heard me talk about this.
What is that?
The black circle. It's supposed to be a big half black circle. It's called a Blvd, the gastric air bubble, the stomach and the air in the stomach. So when I see this stuff here, it's smaller, but I was expecting it to be a little or smaller than that. Okay, and that's fine. Why that's important in your cases, there is digestion. I think there is something neurological there, as opposed to just telling me that it's what's it called? It's chemical. Okay.
Yeah, makes sense. So what causes calcification on the rib area?
Now, the way I was trained is to look at the thyroid parathyroid. Because the calcium or the calcium phosphorus ratio in the body is controlled by thyroid parathyroid. When it's a finding that was taught many years ago to me, and 90% of the time when I see that and I send them for a thyroid panel, the thyroid is a little bit off. If it is, we jumpstart it naturally. Okay, that's all.
Okay, good.
Now, the fun part. So digestion is there, yes. But the main thing I need you to see is that bent sacrum. That's where we're starting. Okay? And whatever else I find. Now let's go to the top. Heart's good. Heart's fine. Right scapula is a little bit off. Okay, we have enough to work with.
Yeah.
Are we clear on this?
Clear.
Any questions on this?
No.
Okay, last thing I want to show you is this flexion extension. So check this out. Look, this is neutral. This is flexion, neutral, flexion. There's not a whole lot of movement here, is there? Mira. So
Yeah.
that's extension. This stuff ain't moving. None of this here is moving. Okay? So your upper is compensating up top here. And I'm sure you get a lot of crackles. You get pops and crackles up there.
I
It pops a lot, yes? Okay.
I had a car accident in 2007, I believe.
Okay. Was anything significant? You were hospitalized?
No,
any
I lost
surgery?
conscious for a few seconds. Didn't know where I was, but
Okay.
no injuries.
You ready to get started, ma'am?
I'm ready.
Have a seat, please. Let's get rocking. So you can see here, just looking from the top even, it's very straight. We need more curve in through here. We're going to start at the base of the neck. Let's see what we find. And the first thing we're getting is 10 points of pressure, C6, C7, left side. Fantastic. Next thing we're getting is 10 points, C1. And we talked about potentially having an upper cervical issue relating to your TMJ. Yes, ma'am? Good. Next thing, as we're running the meter down the spine, we're getting a nice 10-point reading also, around T5, T6. Good. T12L1. You said right kidney stone, ma'am? Left.
Left.
Left kidney stone?
Yes.
Okay. Switched up on me, yo. Very good. Scorpion, huh? You had that in Honduras or here?
Here.
Of course.
Like Guerrero, I just have one laser treatment.
Okay. And you can see it's all starting down low. S3, S4, down at the scorpion's tail. Ay caramba! Ay caramba! You know about scorpions, Shasha? They sting. You see that stinger right there? That can kill you. You be careful. Don't mess with the scorpion or the stinger.
I hear you.
Okay, madame, scoot forward a little bit, please. Feet together. Open and close the knees, please. Yes, ma'am. Open and close. Watch my thumbs, please. Good. Left side only. Open the left knee. Open wide, please. Good. Right side only. Yeah, it's not the pelvis. They're fine. Scoot back for me. They're misaligned, but they're still independent of each other. Next thing we want to do is let's statically palpate. Head down, please. Round your back. Round, round, round. We're going to start at the base of the neck, and what we're looking at, static palpation, we're looking for edema, tenderness, redness, and changes in tissue structure. So what you can see as you statically palpate, when you get right there, it gets puffy, red, and swollen. And it gets worse as we get to around T5, T6, and then it gets orange peely there. And then it sucks back into the spine, and then it does it again right there. Okay. So T5, T6. ¿Duele?
Yes.
Mucho. ¿Arriba o abajo?
Abajo y arriba.
¿Aquí?
Dos. Yeah, ahí.
¿Abajo? No.
Arriba.
Aquí.
Ajá.
Sí.
Ahí.
Ahí. 1, 2, 3, 4, 5, 6. 11, 12. Mucho duele. 11, 12.
12.
12, 1.
1.
1.
Yeah, 1.
1. 6, 1. Let's check now the sacrum. Back slowly towards me, please. Good. Número 5. ¿Duele?
Poquito.
Poquito. Ok. Número 1.
1.
Número 2. Número 3.
Ay,
Sí.
eso.
Número 4.
Oh, that's 4.
Número 5.
5.
I have to be at the coccyx for 1 second, okay, ma'am? Is okay?
Yes.
Aquí. Poquito.
Poquito. Oh yeah, that one. Cinco.
S5.
That's why.
Yo, you're the first Honduran I've seen with the S5, yo.
Really?
Well, first,
Oh,
I've seen an S5.
it's gonna be a big touchdown then.
I don't know.
I don't know.
Touchdown or a home run? You're hilarious. Excuse me. That was funny, by the way.
Oh, right there. Ow.
S5.
Yeah.
Okay.
Those three and
S5, L1, S5, Scorpion's tail, L1, T6, and now let's check the neck, okay? Wow.
Wow, I didn't know it hurts there until you said. I mean, it's funny.
Yeah, because you worked on it already, you said, right?
Yeah, energetically, yes.
Yeah, you were just masking the pain, madam.
Yes.
Right? Sit back for me, please. Now, let's see the neck. T1. T1.
Right there.
Yeah. T1. And C1.
Ow.
Okay, sit up. I'm going to do what's called divorce test. Let's see. Look up. We're isolating the lower cervical. Turn left. Turn right. A little tight on that right side. Yes? Head down. Turn left. Tight. Turn right. Tight. From all of those, is it more restricted and bothersome or painful when you go down and left, down and right, or up and right? Up and left. Which one bothers you the most?
Down and right.
Down and right. So we're going with that right atlas. We have a right atlas. We have T6, we have L1, we have S5. It doesn't mean I'm adjusting all of that today. We definitely working on the basement. Foundation, we got to work in the penthouse. Now, I do want to check the click in the jaw. Okay? And we'll check the click in the hip, and then we'll get you adjusted and recheck. Alright, slowly open, open, open. Slowly close. Slowly open. It's so misleading. So what's happening with her jaw, close, it's doing this, okay? Follow my fingers. You want to watch? Okay. It's so misleading. The right opens first, very subtle, then the left, then the right again. Slowly open, slowly close. One more time. Slowly close. Okay, let me go back to this x-ray. Hold on. It's a little misleading, lady. Ay, caramba. Alright, so on here it shows that the right is thinner, the left is thicker. So the left, but then if we look a little bit more, it deviates from left to right. So it's a little misleading here. You're going to make me work for this, aren't you? Okay. Slow, real slow. It's left. The right is the compensation. It's the left jaw.
Is the left?
It's not the right.
Oh.
It also misled me. You can put the mask back on.
Okay.
You can deal with it later. It's your left, man. The right is compensating.
Okay.
So I was thrown off a little bit too. Now, do I treat a patient? Do I treat an x-ray?
The patient?
I treat a patient. Okay, guys? So if there's
Why is the click on the right then?
it's a compensation.
Oh.
You want me to explain now?
No, I think I understand.
It's this. So the left deviates out first. The right compensates so your mouth doesn't just stay there. So it's doing this. It goes down and out. It's the hypermobility. It's similar to someone who says, you know, and we see this every day. I'm sure all chiropractors see this too. One area is stuck down low. The upper areas are hypermobile. And over time they click and pop and do all kinds of sounds. And then they eventually get stiff and hurt. Sound about right?
Yes.
Okay.
Right.
All right. On your back, please. Let's continue. You ready?
Ready.
Duele?
Not
Okay.
this one, just this one.
Bend the knee. Straight. Bend. straight. Bend, straight. Okay, other side, please. Bend the knee. Oh, yeah. Oh, madame, you got a lot of scar tissue here.
Yeah.
And then you have a slight bursitis. There's a bursa that sits there. The tendons and muscles and ligaments are all over this bursa. The bursa is inflamed. It hurts when I push there. Yes,
it hurts.
That is from misalignment. That's from the pelvis, the altered mechanics. Okay, you ready?
More than ready.
Let's get started. Okay, we're going to start with an Asr Atlas. Right hand up. All the way up. Seat belt to stabilize. Are you okay with that now? Good. And we're going to do the ASR. We're on the right Atlas. Get a nice little soft pinch of that SCM. And hands on your lap. Palms up. Good. And let's just find that sweet spot. Good.
Oh!
And that's the home run, baby.
Oh!
Woo!
You make me see light.
Okay, we'll give it 1 second now. Just from that, I want you to open and close the jaw. ¿Qué diferente? ¿Qué?
I don't know. A lot.
Yeah.
Oh, wow, I see orange.
All right, so now it's time for the scorpion sting. I may call that the scorpion sting on the thing. We've had the cobra, we've had the anaconda, now we're going to have the scorpion.
Okay.
¿Listo?
It's all about creepy creatures.
¿Listo?
Listo.
Respire. Sáquelo. Otra vez. Listo. Respire. Sáquelo. Respire. Sáquelo. I need you to let it go then. Or hold and let the tummy go. Chest, everything into the table. Good. Listo. Now we said the short leg is where on the right side, right? So I need to torque this way in order to bring it up, okay? But I gotta be down low. You ready, man? I need you to receive, man. Receive. Breathe in. Breathe. Breathe. Out. Now, whenever you receive, it's inhalation, right? And whenever you give, it's exhalation.
Yes.
So let's try you breathing in and me breathing out.
Okay.
I gotcha. Home run, baby. I gotcha.
Ay.
Ay caramba.
Ay, caramba.
Ay caramba. Mira.
That was the sting of the scorpion.
I had to get that scorpion, yo. The Scorpion King.
You got it.
I
You got
got
the tail.
I got you, baby.
Oh, you got the tail, scorpion. Oh, wow. Whew. How the Scorpios walk?
I don't know. Let's see.
Walk here?
It's got to be very different right now. I want you to walk 4 or 5 times, okay? Back and forth. As you're doing that, let me know if anything is different.
Okay.
Woo!
I can breathe better.
Nice.
Yeah, I can walk better too. Different.
Yeah, the tail's moving a little different.
Yeah.
The scorpion's tail. I'm
Oh,
talking
yeah?
about.
No, the scorpion's moving.
Scorpion's moving. We just woke up.
It's gonna become a 3D scorpion.
Let's run the meter and see what we find. C1 is clear. Guess what? That cleared the base of your neck too, ma'am.
Awesome.
Mid-back is clear for today, ma'am. Nice.
Great.
Awesome. That's the start. That cleared up your L1. 000. How do you say clear in Spanish?
Claro.
Oh, duh.
But you can say clarines.
Clarines.
Clarines, yeah.
Clarines. Mira. 5. Dígame. 5.
5.
¿Duele?
No, un poquito.
1.
1.
2.
2 no duele nada.
3.
3 nada.
4.
No, poquito.
Mira.
5, no.
You remember what it felt like?
Yeah, yeah. It's
Bueno.
just a little bit.
Little tender, right?
A little tender.
You're all clear there, ma'am. Let's continue now.
Mm-hmm.
Questions on anything I did there?
No.
Boca arriba. Derecho. Raise up. Bend your right knee. Bueno. Let's check the left click.
No pain, no gain.
No click. Do it yourself.
I usually do it to the right.
Do it.
I feel a little bit still.
Diferente?
Yeah, it's feel it deep inside.
Deep inside, but
Yeah.
it's different now?
It's different.
Open. Close. Open. Okay, so we're going to do the compensation side first here.
Mm-hmm.
Right side, we're going to push lateral to medial. And then we'll see. Open all the way. Close half. Hold there. Open. Close. Open all the way. Close half. Hold. Now let's use the little buff and polish. Claro. Claro. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1.
Oh, wow. I really like that.
Nice. Sit up straight, ma'am. I need to set your shoulders now, okay? You can
Put that on?
Yeah, you can put that back on. Okay, shoulder. Relájate. Relájate.
Oh!
Bueno, relájate. Relájate. There you go. Boca arriba, let's do the ankle. Alrighty. Mucho duele.
Yeah, mucho duele.
Derecho.
Izquierdo,
Izquierdo.
izquierdo.
Izquierdo. Okay, now, I'm not yanking on your ankles today. I'm not doing the pull because we did S5. I will use the board to start the process. Next visit, we'll use the lotion and go deeper in breaking up the scar tissue.
Okay,
Because of the S5.
that's fine.
It's too low. Raise your right leg. Relax. Raise your left leg. Turn to your right side. Left side. Turn to that side.
Okay.
Bend the top knee. Bend the bottom. Other side, please. Bend the top. Bend the bottom. Relax this here. And you have that. Nice. Stand up. Walk again a couple of times. Now, this time as you're walking, tell me anything, what's different now as you're walking?
I feel lighter.
You feel lighter?
I feel lighter and I can breathe. I can walk like a female. Like a...
Walk on your toes, please. You can wear your heels again. Walk on your heels, please. Good. Okay, back over here now. Let's do the buff and polish. Now the buff and the polish, madam. Cool.
buff and polish.
Vibration therapy, 170 hertz frequency to 180. It's vibration therapy, not percussion. The idea is to break up scar tissue. Siéntate recto or derecho. In El Salvador they taught me recto.
Recto?
Siéntate or siéntate recto. And then here I said that to some people, they're like, no, derecho.
Derecho.
Awesome. Breathe now, breathe. I've been seeing a lot of those from patients coming to me, you know that?
Yeah?
Entiendo. Sí. I've seen a lot of those, Shasha. All right. Walk it off one last time, and then we got to do the hands. Check the hands, okay?
Okay.
You got it. You got your groove back now?
Yeah, I got it. I like the groove.
Jokes aside, how's the joke?
It's good.
Different, yeah?
I don't have the click.
Okay. Well, we'll see also next visit, right? Because you had that before, and then it came back. So we'll see what happens.
I think with you.
Hip. Different?
Yeah, I don't hear it. Oh, I still hear it there.
It's just
A little bit.
It's okay.
Yeah.
Okay, what I want you to do, remember, what these clicks are, it's the ligament and tendon riding over the misalignment. So it's like the pulley at the gym, right? When the pulley is out, that cable starts to hit. That's what you're hearing.
Okay.
Squeeze my hand, let's check. Squeeze. 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 Stand right here, please, if you don't mind. Squeeze. Squeeze. Elbow. Radial head. Why don't you come over here? Let's do a different angle.
Yeah.
Come over here. Let's do radial head. Right over here. So I'm doing the radial head right here on the back side. There you go. Next is we're doing the lunate. Thumb. Let's try the other side now. Squeeze. Same thing. Let's do the radial head. Let me do the work, please. Relax the head. Good. Good. Gotcha. Gotcha.
Oh.
Squeeze. Squeeze. Go like this 5 times. Questions?
No.
Squeeze.
Oh yeah, I have a question.
Yes, ma'am.
How do you do it?
How do I do what?
How do you do what you do? I mean, I've seen videos online, and I gotta say, you are a very compassionate doctor. And that's what makes you, like, the patients want to come to see you. That's what I come and see you. It's just the compassion that you show to the patients and how happy you make other people. It's just, healing comes instantly when they come here and they come out, you know. It's just amazing.
I appreciate that.
Yeah.
Okay, but I think it's just, people make comments, and with me it's love, it's tough love though. All right, I can't sit here and baby every patient.
No.
Because they've already done that, and then when they go to doctors and therapists that all they want to do is therapy and make them feel good and baby them, it doesn't really fix the problem, you know. And with me, I've seen enough where sometimes I know a little bit early, but we have to go through the journey together, right? You have to understand, just like everything, and I like to spend that time for everyone to understand their issue. And I still have work to do. I haven't done my job because, you know, I've been doing this 18 years, and the work has been the same for me. It's working with different types of people and managing a lot of anxieties and expectations. And what I mean by that, I'm saying this with a lot of love, is when you don't understand what's going on, there's too much fear, right? When you understand, the first thing that goes is fear. Then you can heal.
Yes.
Right? Then you can actually heal.
We're healing the root of the cause of the problem.
Correct.
And it's going on a lot right now.
Correct. And then the other thing is, you know, there are a lot of different techniques. Everyone has their thing, and it doesn't mean that everything has value. It's what's the intention. My intention is always to help you and everyone find the cause, okay? Not treat a symptom.
Right.
But if I've done my job, guess what happens? Guess what happens?
What happens?
The symptoms go. Why? Why? Because we expect miracles here. Welcome to the office.
Thank you.
You're
Yeah.
welcome.